If you've had a C-section, then you'll want to avoid these three major problems that can happen to you if you don't massage your C-section scar. So stay tuned to learn why massaging your C-section scar is so important for you and why your doctor's not telling you to do it in the first place. Hi, my name is Lynn Schulte and I'm a women's health physical therapist. I work in Boulder and Denver, Colorado at Intuitive Hands Physical Therapy, and I am your postpartum recovery expert. And today we're going to be talking about why it's so important for you to massage your C-section scar. And there's three main, very important issues that can develop if you don't massage your C-section scar. And a lot of doctors don't get the correlation or really understand exactly what scar tissue can do and how it can create problems in the body. So if you're to ask your doctor, oh, well, should I massage my C-section scar? They'll probably say, well, the literature doesn't recommend or doesn't support that it has any benefit. But I'm here to tell you that it does. And by massaging your C-section scar, you can avoid three main issues that can develop. And sometimes these issues don't happen until you're 10 to 15 years past your surgery and you start developing these problems. And by that time, nobody's thinking that the problem lies in your C-section scar, but it does. So the first issue that we're going to be talking about is bladder frequency. So if you don't massage your C-section scar, you can develop an issue where you have to pee all the time or you feel like you have to. So what's happening there is that you can see this is a cross-sectional view of us, and this is your pubic bone here, your bladder, your uterus, and your bowel. And if you look at this this uterus, if you can imagine, really expanded with a big baby in there, when they go to cut the baby out, they cut right in about this level. And when the uterus shrinks back down, it creates scar tissue to heal the tissue that's been cut. And the scar tissue attaches to everything and anything in that area. And it will attach to the bladder here. And what happens is the bladder actually has stretch receptors in the walls. And when the walls get stretched, it sends a signal to the brain, oh, I gotta pee, and then you go to the bathroom. Well, if the scar tissue is preventing this bladder from being able to expand, every time it gets stretched, it's gonna send a signal to the brain, I just have to pee, even though you just went 20 minutes ago. So that's what's happening a lot of times is the scar tissue is inhibiting the bladder from being able to expand and hold the urine and get larger. So getting in there and freeing up this scar tissue allows the bladder to resume its normal holding ability, which is you should be able to go every 2 to 3 hours. Your bladder should hold that long. But when scar tissue is restricting it and keeping it small, it sends that signal, oh, I gotta go. So that's why you get bladder frequency, and freeing up that scar tissue can eliminate that. Again, one session, and I've been able to help women pee normally again after having this issue. So the second issue that we want to look at is deep thrusting pain with intercourse. Now, what's happening here is the same issue with the scar tissue, inhibiting this area here. With intercourse, when the penis comes in, it's really important for all these tissues to be able to move up and down with thrusting. But if you insert and you hit a brick wall here where the scar tissue is, it's going to feel like ow every time he does. So that's why if we can get in here and free up this scar tissue so that all this tissue can move up and down like it should, then you get rid of that pain with deep thrusting with intercourse. So that's what's happening with that issue. Now, our third issue actually is low back pain. What's happening with the low back pain is, again, scar tissue related, but there is a uterosacral ligament. And you can see this drawing here. This orange is the uterus and the purple are the uterosacral ligaments on either side attaching to the sacrum in green there. And with C-section scars, I have not met a C-section scar that is not tighter on one side more than the other. And when we get more tightness, what happens, if you can imagine, maybe say here on this side, that this is tighter, it's going to pull that uterus forward more. And so can you see, if this uterus gets pulled forward, it's going to pull the sacrum on that side too. And that's going to restrict this sacrum from being able to move in this sacroiliac joint. So the tightness in the front is actually pulling things forward, and because it's more tight on one side than the other, there's a rotation happening in your pelvis that is creating pain in that sacroiliac joint. So when you free up that tissue and get things moving and even in there again, then the sacroiliac joint, the sacrum, can move freely like it needs to, and you get rid of that pain. Now, I had a girlfriend who has the same age boys that I do. We both have two, and she had 2 C-sections. And this was probably, 6, 8, 10 years ago, I forget now, but a while ago. And she came to me because she had low back pain. And all I did was work on her C-section scar. I didn't even touch her back. I just got in and released her C-section scarring in there. She was actually getting ready to go camping, was thinking, well, maybe I'm not going to go because my back's hurting me. And I worked on her, and she got off the table. She had no back pain. She was able to go camping that weekend and had no problems. So fast forward 2 years, and she's getting ready to go camping again, and her back goes out on her. I think she has an issue with camping, but that's another story. She came to me because her back was hurting her, and she was thinking, I'm not going to be able to go this weekend. And this year, 6 months prior, she had had knee surgery, and so she had been hobbling around on a bad knee. And so when she came to me, I thought about that and said, okay, well, let's mobilize her pelvis. I mobilized her sacrum. I worked on her low back. I worked on her leg, and, adjusted all this stuff. And then I ran into her the next day, and she's like, no, I still got pain. And I went, oh my gosh, it dawned on me, I never worked on her C-section scar. So we were actually at a school function and a picnic, and I laid her down on the picnic table, and I released her C-section scar. She got off the table. She had no pain and was able to go camping that weekend. And to me, that was like the ultimate sign that C-section scarring can cause low back pain, and by releasing it, you get rid of the back pain immediately. And she told me, I tell her that I tell this story all the time, and she goes, oh my gosh, tell him it works, because every time her back starts to bother her, she just does some massaging of her C-section scar, and it goes away. So that's the importance of it. And so I just invite you to really get in there and massage your C-section scar. I have another video that tells you exactly how you need to do that, and I'll link it to this one. So check that out and get busy with massaging your C-section scars so you can prevent these 3 main issues of bladder frequency, deep thrusting pain with intercourse, and low back pain. And know that some of you may have a hard time actually touching your C-section scar. This is pretty common for women. If you had an emergency C-section, or it might have been a traumatic experience for you, you may not want to touch that area. And I want you to just recognize that that's, your body's trying to protect yourself by avoiding that area. And there's some trauma work that you can do in releasing that so that you can tap into and actually touch and work with that area again. So don't force it. If you're, having a hard time massaging that area, I just really invite you to go get some help. You can get some therapy. A lot of people work with traumatic response in the body. EMDR is a great modality, but you really want to clear that out. And also recognize that with C-section scarring, what I have found to be really related is the amount of emotion that is held in that scar. So again, if you were afraid, or it was pretty traumatic for you, there might be some anger, there might be some disappointment. There's a lot of emotion that can be tied into that area. And I have found that when you release the emotion, the scar tissue completely shrinks in size. It's amazing. I worked with one woman who had a vertical C-section scar, which you hardly ever see these days. And when we first started mobilizing it, she felt the scar was as thick as my thumb here. And when we got done, so I helped her work on it, and I just felt into it, and I could feel the anger that she had. And when I gave her permission to experience and have that anger, she was able, and we worked around that and released it. Immediately, the scar became as big as my little finger. It was amazing, the difference in the scar's ability to diminish in size when you release the emotion that's attached to it. So I invite you to give yourself permission to feel whatever emotion is there. The more you can recognize it and give it permission to be there, the easier it is for it to dissipate and dissolve and release from your tissues and allow that scar tissue to shrink, okay, and release. So do what you can. If you're not getting anywhere and you're still having issues, please reach out and get help. If you're in the Boulder, Denver area, I would love to help you out. A lot of times I just see women one time release their scar tissue, and then I help them learn how to do it themselves so that they can continue to maintain it. Scar tissue forms for up to 2 years. Literature says 9 months to 2 years, so I just go on the longer range end of that one and just say keep checking in with it up until that 2-year mark. Initially you check it, you do it daily until you get it released, and then you check in once a week. When it stays released every week, you check in, then go to once a month checking in and making sure that the tissue can still stay released and is still as mobile and free as it was. If it's not, work on it a little bit more, and then just keep checking it once a month until you get to that two-year mark, and then you should be good to go. You shouldn't have to worry about it. But recognize that if you start getting bladder frequency, deep thrusting pain, or low back pain, then you might want to be thinking about massaging your C-section scar again. Okay, I hope that helps everybody. Thanks for listening, and good luck with that. Take care.